Welcome back to Jersey Matters. I'm Larry Mendte. Over half of the coronavirus deaths in New Jersey come from nursing homes. Two nursing homes, in particular in North Jersey, made national news. The New Jersey Veterans Hospital in Paramus and the Andorra Subacute and Rehabilitation Centers. There have been over 70 deaths in each of those facilities, and those facilities are in the 5th Congressional District. I spoke to Democratic Congressman Josh Gottheimer on what he plans to do about this. Congressman Gottheimer, thanks again for taking the time to talk with us. I know we just talked to you a couple of weeks ago, but since then we've had some horrific reports from nursing homes. Two of the highest death tolls in nursing homes in the country have both been in the 5th District, in your district. Let's take them one at a time if we could. Starting with the New Jersey Veterans Hospital in Paramus, where they've had over 70 deaths. I know you've reached out to the VA. Have you heard anything?
Yeah, as you point out, 74 deaths, and more than 90% of the veterans there have either had COVID or are now COVID positive. Just gives you a sense of just how widespread it was and it has been in this facility, which is heartbreaking, right? I mean, it's just, you can't imagine it. We quickly after I learned about it, it's a state-run facility. We helped get the National Guard on the ground there and medics there, and the VA has put people on the ground there and to help out. And really, the big focus has been, how do you make sure that the staff are healthy, getting enough staff in there to take care of folks? How do you separate out COVID versus non-COVID, and so that it doesn't spread further? Is there enough protective gear for people? And also communicating with family members, and this is something that wasn't happening. So a lot of family members had no idea. In fact, when we learned about it from a family member there, there were already 35 or so deaths in the facility, which is just horrific. So it's been an ongoing struggle. We had doctors, some of the best physicians from our local hospitals, and they really have been in the eye of the COVID storm, show up there about a week ago to help provide some more consulting with the physicians on the ground there and the medics on the ground to make sure they're doing everything humanly possible to help take care and save these veterans.
What you talked about just a second ago about families not getting enough information is not just at the Veterans Hospital in Paramus. This is a problem at nursing homes across the state that I've been hearing from families and hearing from the AARP. It's inexcusable that families aren't able to see their loved ones, sometimes in their dying days, and not even able to get information on them. How do we fix that? And that's not a long-term problem. That's something that should be fixed now, right?
I mean, you're exactly right, and it's heartbreaking when you talk to these family members. So COVID happened, and it's nothing that anybody put there, but when it gets in, it spreads like wildfire. So I understand why facilities have had to keep family members away, because they don't want people coming in and bringing into their facilities. That said, as you pointed out, what happened in so many long-term care facilities is that nobody called and said, your loved one is really sick, has been exposed to COVID. We've heard so many cases where family members had no idea at all that it was spreading in the facility. And so no chance to say hello or goodbye to their loved ones and just check in with them, which is so painful, not just for the family member, but of course for the resident of the facility, who's scared and rightly scared. So to me, that's unacceptable. And this legislation I introduced, bipartisan legislation, actually requires communication and updating with the family and regular reporting, because that's something that I'm hearing about from family member after family member about how upsetting that is.
At the Andover Subacute and Rehabilitation Centers 1 and 2, not only did they weren't able to contact their loved one in their dying days, sometimes they didn't even know that they had died until days later. Again, it's horrific. It seems unacceptable. It almost sounds criminal. What can be done there? Is there a federal response to that?
I mean, again, these facilities, including Andover, are overseen by the state. So what we're pushing for now is much stricter oversight and regulation of these facilities day in, day out. Put aside COVID when we get past this, we should make sure that these facilities have crisis plans in place, make sure that they actually have protective gear in stockpiled in case there's an outbreak in the facility in Andover. And I think you and I talked about this when I first got a call on a Saturday night, because they needed 20 extra body bags, which is just unthinkable. Because so many people had died in a short period of time. And then we find out, I demanded oversight, and we got the federal government there to look at it. And what we found out from the report there was just how much worse it was than we even thought. That family members weren't told anything, that people were sick and had fevers, and that no one called in the doctors for them, that there wasn't protective gear on these staff members and nurses who were working so hard. They weren't given what they needed, which is horrific. It was just not well run. And frankly, it's just completely appalling what was allowed in that facility. We got the National Guard there on the ground now to help out.
I noticed that you had called for Medicare and Medicaid inspection reports back on April 10th. So you were pretty far ahead of the news reports. So I assume that came from your constituents asking you for help.
Yeah, I mean, we heard, we're just like I know I've spoken to families. We were getting calls in from families, from staff members saying, hey, there's a 5-alarm fire here, and we don't have protective gear. They're not separating sick patients from those who weren't exposed and infected. So it was actually spreading further. And also, you need to make sure, and the CDC guidelines require this, that if a caregiver is in a COVID wing, they're changing their gear before going to a non-COVID wing, so they don't bring the infection with them. You also need more testing, and yesterday the governor announced that he's requiring by May 26th testing of all patients and caregivers at long-term care facilities, which is obviously essential. But if you don't test people, you don't know if they're coming in. They might be carrying it, and then they unknowingly give it to people inside the home, and then of course it spreads. So you just get a sense of how deep this goes. And again, there are operators who've done an excellent job, and there are operators who, as you pointed out, I just can't believe they're allowed to run these homes. And I don't know how they look in the mirror. And frankly, I want every single one of them investigated, and we should know exactly who they are and what they did.
The last time I talked to you, you talked about the SALT deductions hopefully being in a relief package coming up. It sounds like you got what you wanted.
That was a big win for Jersey. We need these tax cuts. We need to put dollars into the pockets of people to get this economy moving and people here.
Well, great. Thank you again, and be safe. That was New Jersey Congressman Josh Gottheimer. When we come right back, you will hear from a man who has nothing but good things to say about a New Jersey nursing home that took good care of his father in his dying days. That's when Jersey Matters comes right back.